Morning, everybody. So, what we wanted to talk about today is what we call addressing difficult situations and capturing stories. And what I'm going to talk a little bit about is some best practices, some techniques, and then we're actually going to give you guys a chance to talk to each other and do a little bit of role playing, because listening to talking heads all day can, let's face it, get a little boring. So, with that in mind, I wanted to start off by talking about what makes this difficult, what makes it challenging when we're looking at this issue. And none of this is probably surprising to you, but it's something that I think helps us kind of put this in perspective. And first of all, healthcare overall is a intensely personal, emotionally charged, difficult issue. Ryan this morning started off by sharing a really personal story that impacts his family. We have done focus groups across the state over the past few months, and one of my colleagues who's been leading focus groups and doing research for more than 20 years, a lot on healthcare issues, said these were some of the hardest and most emotional ones she's ever seen in her life. We had grown men, farmers in southern Missouri, breaking down in tears, talking about what lack of coverage meant to their daughter or their spouse. We had people who were looking at and talking about, what does this mean for my children? What does this mean when I'm telling my son he can't go out for football because we don't have health insurance and it's way too dangerous and I can't risk him breaking his leg? And what does that mean about his college scholarship opportunities? This is really personal, it's really intense, it's really emotional. And then just to make it more complicated, let's add in insurance, which involves money. How many people like talking about money? I don't. And money can also be a very emotionally charged personal issue, especially if you don't have enough of it, or enough of it, at least as much as you think. And then it's also really difficult and confusing information. When I look at my plan choices that I'm very fortunate to get through my employer every year, and I get this big booklet, and they're having webinars, and people from our talent development group, which is what we call human resources, come and talk to us. Even my eyes kind of roll back in my head, and I kind of look, and it's like, well, a little bit of eeny, meeny, miny, mo. Which plan do I pick? I don't know. It's complicated. And I kind of do this for a living. And we all do this for a living. And so for folks who are not used to using insurance, it becomes even more complicated, even more difficult, even more challenging. And we also know that when somebody feels like they don't know enough information, sometimes it makes them feel stupid, which is absolutely not the case, because this is complicated, difficult information, but their guard goes up, and that gets a little bit difficult, and that can be a challenge to effective communication. And then let's add in the concept that we're talking about, the marketplace. And this is part of the ACA, part of Obamacare. That's been a rather political, hot issue, I think, over the last couple of years. Would you guys agree? And it's also unknown. There are some questions right now that we have to say we don't know the answer to yet. That's a difficult thing for somebody to hear when we're already adding in all of these other factors related to being health insurance and healthcare coverage and all of that. And it's also hard because it's in development. And that does not necessarily, that sometimes prompts more questions than what we can answer. And so that's part of what makes this so difficult. So then, moving from there, we ask about, before we get into the sticky stuff, we wanted to talk about what are just some keys to effective communications. These are good practices that you can use at any point whenever you're talking to folks. And the first thing is consider your audience. Think about who you are talking to. Think about what is the mix in that room. Am I talking to primarily business owners? Am I talking primarily to moms? Am I talking to 20-somethings? They're going to have different perspectives. We're not delivering different information to them. We're just thinking about where do they come from. And in fact, as you probably heard from my colleague Brandy and from the great panel that you just left, that being consistent is really important. And using those key messages to help deliver that information. As Brandy probably shared, or at least I hope she shared with you, we are inundated by information. It's great. It's wonderful to live in this time where you can go online and you can Google. And didn't we all want that when we were back writing papers in high school and college? It would have saved me a lot of hours in the library and many, many, many overdue fines that I had to pay in order to get my grades. But part of having access to all that information means that it's more challenging to get your message out. And then we also say anticipate the hard questions. And that's what we're going to really spend the rest of today talking about, are those hard questions. But the very bottom line, if it's not what you came there to say, don't say it. Don't let yourself get off on a tangent by bringing up something that can distract or derail the conversation or the presentation. You want to stay focused, and you want to be able to get your message across, because people are really busy, and we are fighting against all of the other bits of information that are out there. And when you think about somebody who may be listening to a segment on the radio or watching something on TV, chances are they're negotiating with their kid about, soccer practice and who's getting picked up. They may be trying to make dinner. The dog might be barking to come in or out, or in some cases both. We're fighting to kind of get their attention, to get their focus. And so we need to make sure that we're staying focused to that extent. So let's talk about what are some types of sticky situations. We categorize this, and that's a technique that we're going to talk a little bit about that can help you address questions. The first category we consider is what we call personal. It may be that they've been denied coverage in the past, so why should they try again? I've tried to apply it 1,000 times. I can't get accepted. Or I don't care how cheap you think this is going to be. There's absolutely no way I can afford it. So why should I even go through that process? You're going to hear those sorts of things. You also may hear things that somebody that maybe focus more on a personal level. I don't believe in birth control, and these plans cover birth control, and I don't like that. There's those sorts of personal issues that certainly are out there. There's also ones that we're kind of categorizing or we're describing as professional. What is this going to mean for my brother's small business? Or my benefits have changed at my own company, or my hours have changed, or my sister's hours have changed. Those sorts of other concerns and difficult questions that you may get. And then last but not least, there's also what we're kind of calling the political examples. This is bad for the country. What does this mean to the national debt? I don't believe that we should have a law like that. I don't think this is the right role of government. Those are all things and concerns that we're going to hear from people. And those are some of the examples of what do we mean by sticky situations. So some rules and best practices on how to deal with this. First of all, stay calm and listen and acknowledge the concerns that are out there. And that sometimes can be a little bit harder than you think, because it can be kind of a crazy sort of thing, and there's lots of action going on, and you have somebody who may be rather upset and being very vocal with you, or you may have somebody who personally is very upset and getting very emotional. As much as you can, stay calm, and then also listen to what they have to say, acknowledge their concerns. There's so much misinformation out there that some of the concerns they may have may simply be a result of pure factual error. And so you have to step back and you have to kind of listen before you say, oh, this person's never going to be interested, or this person's opposed to it. You need to stop and really listen to that. And again, I know this goes without saying, but it's really important to make sure that we're maintaining mutual respect. Our charge and what we're trying to do right now is educate, not persuade. We want to make sure that everybody is equipped with as much information as they possibly can be to make the decision that's right for them. That is our number one goal. Michelle and the MFH team has been absolutely phenomenal and terrific in terms of reviewing each and every item and each and every word on the website and in all of the 25 different pieces of material out there, in case you were counting, to make sure that it's factually accurate and that it's neutral. The Missouri Health Literacy has been phenomenal in making sure that we're getting it as simple to read as possible, and that's a little bit of a challenge when you're dealing with insurance. But again, our goal is to make sure people have the right information and are equipped. And then also avoid escalating the situation. Avoid kind of buying into it and getting into that debate, even though you may kind of deep down want to. It's not necessarily going to help achieve the goal of educating people, and again, avoiding that escalation is really critical. And then stepping back and putting yourself in their shoes. again, it's a really personal issue. It's a very emotional issue. And it's one that can be very complicated. And so we do ask to kind of like take that moment, step back a little bit, and put yourself in their shoe and recognize that what they're feeling and what they are addressing, and then as much as you can, address their questions and concerns. And then as part of that, one thing we're really recommending is that you separate fact from opinion. And this, we refrain from saying agree to disagree, because it's not so much that. It's more saying, we recognize that you may be completely opposed to the concept of the ACA and the concept of a health insurance marketplace. The reality is, it is the law, and that, that's what we're here to talk about today. And we completely respect that you disagree that it should be the law, but it is the law today, and that's a way to address it. And so separating fact from opinion is really an important component of what you can do when you're addressing these situations, or to be able to say, there are people who may say, I think that people who use more health care, maybe if they are really expensive, they should be denied coverage, or maybe they should, pay a lot more in care because they're really sick and they haven't taken care of themselves. You can separate the opinion, certainly understand, recognize that's your opinion. You can, if you agree or if you disagree, you can say, I may not share that opinion, but what I can tell you is the way the law is set up is X, Y, and Z. And so you can separate those two elements. So then preparing for tough questions. First of all, I would really say stop and brainstorm all the possible tough questions that you think are out there. Many of you have been out there talking to people and you've heard a lot of these tough questions already. But it never hurts to really stop and think through that whole list. Then take some time and work with a colleague and say, hey, can we sit down and can you pepper me with some of these questions so I can get practice answering them? If there's a question that you avoid, inevitably you are going to be asked that question. And so we really encourage you to have somebody, because even though you may think it through in your head, it's a little bit different when you have to speak it out loud. And encourage your colleague, and we're going to do this in a little bit, to even kind of ask a follow-up question and say, well, yeah, but what about this? And then one really effective way, because again, a lot of times when you're going to be doing this, you may be at an event or something like that and you're getting peppered with questions from 1,000 different places, is look at categorizing it. And so when you hear the question, you can then think about, okay, that's the question, this is how I can address it. So if they've got philosophical disagreements with the ACA, with Obamacare, with how things are set up, you can go back to the message that that's really the law of the land. Completely understand that you disagree with that. But today, here, in August 2013, it's the law. And, certainly respect that you disagree that it's the law. You can also look at analogies and things like that. There's lots of laws that we may not personally agree with, but that we may obey. There's a lot of people who think that marijuana should be legalized. Doesn't mean that they're out there smoking it. There are some states that have chosen to legalize that. There's different analogies that are out there. Folks who are getting into kind of the personal component. Why should I do this? I've been denied in the past. Why should I, I know that I know that they're going to reject me, or those sorts of things. You can bridge to the message of there are new consumer protections out there. This is what it may mean for you. A big concern that I think we should anticipate that we will hear a lot, and many of you have probably heard it, is the cost factor. Again, that's part of the unknown. We can't tell somebody right now exactly how much that costs. We'd love to, because at least we could start addressing it. But in the meantime, we can certainly talk about what is available out there. What are the tax credits? Even after we know some of the costs, I think it's fair to say that there's going to be a lot of people who are going to assume that it's out of what they can afford. And we'll talk about, there are options to be able to talk about how we can make this more affordable for them. So when you start hearing the cost things, you can start thinking about, okay, what are the information bits that I have that can help address that message? And then also take a chance whenever you're asked a question to incorporate more information into it. So somebody may ask you a yes/no question. A great example of that will be, are these plans any good? Do they cover everything, or is it going to be one of those things where my doctor gives me a prescription, but then I can't afford to fill it? One way to address that question would be, yes, the plans cover prescription drug coverage. You can actually bridge that into a bit more of information. All plans, the plans will cover prescription drug coverage, which means you can get your prescriptions filled, but they also have a lot of other benefits. Let me tell you about some of those benefits and talk about the essential health benefits that are part of that. You can use those opportunities to deliver more information. And then just a little hint, and this is something that we can practice as a panel, particularly if you're in a large group and people cannot always hear, repeat the question back. You don't necessarily have to repeat it word from word. Sometimes you can just paraphrase it, but it helps somebody understand what is the answer that you're providing. So before we get into a little bit of practice, I wanted to stop and talk for a moment about collecting and sharing stories. One of the things that is really powerful in communicating about issues that are this difficult and this complex is the power of the personal story. We're all drawn into personal stories. We learn that way, and we want to really make sure that we are collecting as many stories as possible from across the state, and we would love your help in doing that. The purpose of this is to, first of all, understand how is the marketplace functioning. Are we looking a reporter actually asked me after the last sessions, are you just trying to collect the good stuff? Or are you collecting everything? And we really want to understand how is it functioning. So we want to hear from those people who have terrific experiences. We also want to hear from those people who potentially are left behind because Missouri has chosen not to expand Medicaid. We also want to hear from people who may be having challenges with the enrollment process. That's how we can fix things and make it better. And so we want to make sure that that we understand how is it working. And along those lines, it helps us figure out what are barriers that we can really address with this. We need to have those personal experiences. And then we also want to be able to share those stories through a variety of ways. It may be that we're, when folks come to us and are looking for somebody who can help tell a story, that we use them, maybe through some materials, it may be sharing their story online. But we know that people can learn from others and that people can be motivated when they see an experience that's similar to them. So if they are a working family with 3 kids, trying to balance everything, and that they see that this works for somebody, it can help motivate them to do that. So as part of that, we've established a story collection process. There are 3 handouts at the back. I saw many of you picking them up as you came in. If you have not, please feel free to grab them. But they provide a lot more in-depth information than I'm sharing right now. The first one, which has the project overview, talks about exactly what the process is. It has frequently asked questions, a lot more information. The second one is an agreement to participate, and the third is a postcard. So essentially how this is going to work is that, first of all, we need your help. We're asking for your help in identifying people who want to share their story. This is certainly absolutely voluntary. And so if you're talking to somebody and they have a really compelling story that they want to share, we'd encourage them to fill out this postcard and send it in. Then we have a team of people who have volunteered to call them, interview them, get some more information, because as you can see, this is a really short card, and that's deliberate. We wanted people to be able to do it relatively quickly. And we're going to interview them, we're going to get information, and then we're going to confirm that they are comfortable sharing their information, and that'll be kept in a confidential file. Our primary goal on all of this is to maintain people's privacy, and so with their permission, and only with their permission, we will then share their story publicly. And this will be a great way for us to really collect stories from around the state. And so, again, if you could, we really would encourage you to pick up these materials. If you want to, we'd love it for you actually to sign the agreement and give it back to us today. But because it's really going to be critical for us to have the personal stories and the personal impact that's out there so that we can learn, and more importantly, so that we can also help motivate others to take action. So at this point, I'm actually going to give you guys a chance to practice a little bit of this. I know you've gotten a lot of information in the last session. We just went through a whole lot of things really quickly. But we also don't want you just to be sitting in a room listening to people talk all the time. And so what we would like to do is work in groups, pair off, or you can work in a threesome, whatever works best for the geography of where you're at. We're going to be real quick with this, and we're going to take about 4 minutes, and you'll each have the opportunity to be the person who may be a little upset and have questions, and the person who's trying to address those questions, and then you'll switch. We'll do a short debrief, and then we'll move into the panel discussion. You guys are probably the group that's going to benefit the most because you're coming right off of key messages into this. You don't have lunch in between, or the poor group that was in front of you, this was their very first session. But it's really going to be a great chance for you just to put this into practice. So the first scenario that we're going to have you work with is that you're at a community event. You're kind of standing at a table, much like many of us have been doing today. And a woman comes up and she's really opposed to the Obamacare. She thinks it's going to completely bankrupt the country. And her plan is that she's going to protest because she thinks this is so bad. By refusing to get health insurance, she's going to pay the fine. And she's absolutely appalled, completely appalled that you are here and you're talking to people about this. And so one person gets to be that character. The other one gets to respond to it. And then after 4 minutes, I'll call time. And we'll switch. And at the same community event, so, she leaves, you have a break, you get a few easy softball questions, and a guy comes up. And he's recently switched jobs. He's doing freelance work. He can't get insurance. He's had a heart attack in the past. He's tried to get insurance. He's been denied coverage. And he thinks that it's just a waste of his time to even apply. He knows that he's going to be completely denied. If he's not denied, it's going to cost $1 bajillion a month. He can't afford it. And so why should he even take any time to go through this, because there's nothing out there that can help him at all. And so he doesn't even want to visit the marketplace. So again, we'll take about 8 minutes. I'll call time around 4 minutes, and then we'll do a quick debrief and move into the panel discussion. Any observations that you had, particularly on scenario 1? I mean, were there any thoughts or obstacles that you guys had? Yes. That's a great point. And one of the things you may notice when you peruse the new website and the materials, we actually don't use ACA or Obamacare a whole lot for 2 reasons. One, when we actually did some survey, a lot of people don't know what the ACA is. They've never heard of it. And Obamacare, people tend to go one way or the other. So actually one of the things that we tend to do is just talk about the new healthcare law or the health law. Things like that. It kind of takes some of the political nature out of it. But certainly, it's one of those things where it's a complicated issue, and that some people love it, some people are like, yay, and other people are like, oh, I hate it. But that's a great point.
This is really funny. I was just sharing that I was at a business after hours last week in Joplin, and I met both of those people. It's really funny that you have that up there.
Well, good. I'm glad they're realistic scenarios. Any thoughts on scenario number 2? Yes.
We talked about the fact that this gentleman would have to be convinced to go online and search, but then also be given the customer service phone call and possibly sit with him to assist him while he makes that search and makes that phone call.
That's a terrific point. And so one of the things that they said is that this is somebody who you probably need to spend a fair amount of time with. I think some other key points to think about for this gentleman, for Mr. Heart Attack Denied Coverage, and policies cost too much, is actually there's a lot of great bits of information that you can share with him. First of all, that you can't be denied coverage because of pre-existing conditions. That is something that a lot of people really don't know, and that's a really important point to be able to speak to. Second of all, the cost factor. If he's doing freelance work, there's a really good chance that he may qualify for tax credits that help defer the cost. One of the tools that we have out there is that we have a chart, and we broke it down by hourly, weekly, and hourly, monthly, and annual. Sorry. Anyhow, we broke it in 3 categories to help people easily kind of look and say, where does it fit? A family of 4 can make almost $95,000 a year and still qualify. That's a lot more than what people necessarily think. So those are some key points there. And then again, this is also where, as we develop the stories, That's going to be a really huge point. And one of the things I neglected to do is do such a call out to the St. Louis University School of Law. You think as a graduate I could have said that appropriately. In Missouri Healthcare for All for really putting together this whole process and for managing it, because it's going to be a huge asset. So any other thoughts on the second scenario? Okay, well then we'll move into the panel discussion. I'm going to turn this over to Michelle.
All right, so we're going to be good and try to repeat questions. And in fact, what I'm going to ask our panel to do, they're each going to share sort of a different perspective on sticky situations that they've encountered with you. And then we're going to ask all of you what your questions are for them. So think carefully as they're explaining their experience, as you think about what I've told you about them, about how they can help you be prepared for what you're going to experience in the field. And I am going to ask them to repeat the question. So I'll call on you, but rather than have us moving this mic back and forth, we're going to ask them to repeat the question back out and then answer the question. So I'm going to go ahead and have Brian get us started here.
Hi, everybody. Thanks for coming today and hearing what we have to say. My name is Brian Colby, and I work on health policy. And I've traveled all around the state for many years before the law was passed, talking about what may be in it, and then talking about what actually was passed finally afterwards, and what's going to be available to communities. And to say that we've had a few lively conversations would be an understatement. And a lot of people had a lot of opinions, especially when things got heated. But when we first started, the biggest lesson I learned was that I was lucky to have a woman who was a PhD, a Robert Wood Johnson Fellow. She sat with the Finance Committee staff and wrote the white paper that was the framework for the ACA. And so I had about as good a knowledge base as anybody could hope for. And we did our first town hall meeting and talked for 45 minutes and answered questions for 15. The next one, we talked for 5 minutes and answered questions for the rest of the day. Nobody knows what the health system is. People inside of it know what their piece of it is. Most folks only interact with it when they have a sick child or a sick parent. And it's scary, it's painful, and it is expensive. So remember that. People just don't know really what's kind of going on. And the thing that they want to know the most is, how does it affect me? How does it affect my kids? How does it affect my business and my family? And if you can answer that, you're going to get a long way down the road. I did a session, a town hall in Cape Girardeau, home of Rush Limbaugh. There was a guy there with a Confederate hat and a Glenn Beck book, a lot of Tea Party folks, and they were very, very interested in rallying things up. And we just answered questions for 2 hours, and afterwards we were all friends and shook hands. And so remember that people come from different places. They truly believe what they believe, even though it's wrong. And it's not your job to correct them. It's your job to tell them what the facts, what's available for them, and then look to see if they may benefit. And you'll be surprised, a lot of people will. You really, really will. Whatever your assumptions may be, go ahead and have them do the online search for possible health solution. If they're a small business, have them do the math. I work with an insurance brokerage firm. Large firm works in about 7 different states, 500 clients. They went and looked at, they did a review of all their 500 clients, found that 90% of them are already compliant with the law. They don't have to make any changes whatsoever. And the 10% that were not only had to make very small changes to be compliant with the law. And when they found that out, they were done. They were no longer angry. They just wanted to go about doing their business, raising their family, and hoping that the Royals will get into the playoffs one of these years. So with that, listen, find out what the people are interested in, find out what they need to hear, what they need to learn, and you're going to get a long way and get around the sticky situations. So with that, I'll move it over to Lisa.
Thanks, Brian. My name's Lisa D'Souza. I'm now with SLU Law School, but for many years before that, I was a legal services lawyer. And like a lot of you, 2005 was one of the worst years I had professionally. I was in Tennessee at the time, but like Missouri, we had massive cuts to our Medicaid program, and tens of thousands, actually almost 200,000, like in Missouri, people lost Medicaid coverage. And so my experience there was working with people who were losing health care. Unlike Missouri, who changed their income limits, we actually closed categories in Tennessee. And so what I was doing was helping people who were losing coverage find out if they were eligible through other categories. And the people I never forget were a family, 3 siblings, 3 adult siblings who came in, all of whom had been in this category that was closing. 2 of the 3 qualified another way, and 1 didn't. And, it was just bad luck that she didn't fit into a category, but sort of breaking the news to them each individually, and then them having to share the pain of 2 people being happy while their loved sibling wasn't going to get health care coverage was very painful for all of us. And we're going to have that experience again because we haven't expanded Medicaid yet. And so the people with low incomes who are perhaps the most vulnerable, we're going to have to explain to them that they don't get to have health care like their neighbors who may have higher incomes and perhaps less serious health conditions. And so I have 2 ways that you might want to address that kind of a difficult situation. And I think the first way is something that probably all of you are pretty well versed in, which is just being present to somebody's pain. I think all of us who work in social services and in healthcare clinics have lots of encounters with people that are in difficult places. And I think really the first thing to do is sort of empathize and be with them and understand that this is happening to them through no fault of their own. They aren't eligible for health care coverage, and it is a painful place to be, and we understand that. And the second thing I would encourage you to do is pick up these cards from the back and offer them an opportunity to turn their pain into power, and offer them a choice, if they want to take it, to join a movement of people who are working to make it happen, that they can have access to health care coverage, so that they know that their pain can be for something more than just their own suffering, but they can have an opportunity to work with other people in their situation in whatever capacity makes them feel comfortable. So, in our last session, some people were sort of feeling like, well, I don't want to make people feel uncomfortable or push them to do something that they don't want to do or exploit their story, and that is absolutely not what we're about, right? We just want to offer people paths to feeling engaged in a way that makes them comfortable. If they don't want to be part of an effort to expand Medicaid, we don't need to push them to do that. But if they feel like they want to come to a rally or be a speaker at a rally or anything in between, there is an opportunity for them to become engaged and know that part of the reason that we haven't had expansion yet is that there hasn't been enough political power to make it happen. And if they want to be engaged and make something happen, they have the power to do that. And so I think being with them in their pain and then offering them a path out are the 2 options that we have to offer people right now.
Thanks, Lisa. I'm Misty Snodgrass. I am a Director of Public Policy for the Missouri Coalition of Community Mental Health Centers, and thank you so much for coming to our panel discussion. I'm going to talk about elected officials. My background is working for elected officials in my past, as well as working significant amount of time in local communities with local officials, as well as at the state capitol. So probably some of the biggest providers of misinformation could be elected officials. I'm going to give you a great example. Last week, there was literally on Twitter a tweet out by a Missouri elected official that was saying, I just encountered such and such at a grocery store, and she's going to lose coverage due to the Affordable Care Act because her deductibles are going to go up by, 3,000%, yada, yada, yada. And so what I ended up doing, and by the time I saw the tweet, there was pretty much every major elected official in the state of Missouri had retweeted it. Former elected officials had tweeted it. And so there was a huge amount of folks that had this information that was misinformation. It was actually factually couldn't be possible unless their insurance company was breaking the law. But instead of saying, oh, that's ignorant, that's not right, what I did was I actually said, hey, actually, there's a great opportunity for this individual. There's this thing called the marketplace, and I did all of this in 140 characters, but I'll expand on it right now. But great place called the marketplace, and this person can, comparison shop, and they can go there, and it's like Travelocity, where they can go and see what the prices are, what the packages are, and they can make a decision based that's best for them, and they can actually go to www.healthcare.gov. And I did that briefly, but I wanted to and I CC'd all the elected, many as I could find on Twitter that had sent it around, and it stopped quickly because there was information out there that that folks didn't have. And so I would encourage you to try to halt some of the misinformation, or try to factually combat it. Don't get into a Twitter war. I see those all the time, and that's not helpful, because then you're just flaming it, and playing into people's passions and frustrations and misinformation. Just combat it with facts. And the thing I can always talk about working with elected officials is that they all come from different places, different backgrounds. They have different constituencies. They have different folks that they have to respond to. And so don't think they're stupid. Don't argue with them. Don't, get frustrated with them. Try and make yourself stronger by giving them information. And so I strongly encourage you. I know you're going to be very busy because we have a lot of folks to enroll, but try to start doing your best as you go forward, as you interact with folks on a daily basis or elected officials on a daily basis. Try to get the facts straight and say, you know what, this is a marketplace. You may, the Obamacare, all of those things, but talk about this marketplace and the great opportunity it will provide you and your family. For example, I could not ever become an entrepreneur if I wanted to, because I am not able to go get health insurance in the private market due to a pre-existing condition, and that is actually true. And so, you can say, look, this is a great opportunity. You may have not been eligible for it. And then the other thing, as Lisa talked about, when it comes to the gap, we are going to have people who are going to fall through the cracks, and it is going to be heartbreaking, and there's no options. It's a cliff, and we need to be able to have these stories to help show elected officials that people in their communities are going to be impacted, and the solution is Medicaid expansion. So I can't emphasize enough the importance of empowering folks to tell their stories, because it will be persuasive. They're going to hear all these facts and data, but the most powerful moving stories that bring people to tears is the folks that are caught in the cracks, and there's nothing that we can do, and there's no way to help bridge them out. For example, those with disabilities, some of those folks are going to be at the 87%, and they are not going to be able to qualify for premium subsidies. And so there's going to be literally no options for some folks. So I just want to emphasize that if you do get into it, make sure you come from a good place with facts.
All right. So I'm going to come up here so that I can see them and you. What questions does this bring to mind? So knowing the rich experience we have, John.
The point Misty was talking about, and that Lisa was talking about, this gap, that is a huge thing on my mind. When you're talking to people who you don't know where they are, isn't it just sort of an obligation to find out that first before you start selling this great program that then you're going to go, oh my, you don't. So maybe a little advice on how to go that direction, because I really feel that's huge.
Right, so the question is, there are going to be people who are falling through the cracks. Do we really want to start by jumping in and selling this wonderful marketplace only to find out later that the person you're talking to doesn't qualify? So I would say, I think it probably depends on whether you're talking to an individual or a group. If you're talking to an individual person, I think it's a lot easier to go through and find out where they are before you start finding out what they need to know or what you want to tell them. And I think that's a great point, is when you're talking to an individual person, it's great to find out what their concerns are, what they're looking for, and if they're willing to talk with you about their income levels and things like that. And if you're approaching them as an applicant to the marketplace, you'll be talking about all of those eligibility things with them individually before you reach the point of what they're eligible for and what they're not. And I think when you're talking to a group of people and giving a presentation, it's great to talk about the marketplace and how wonderful it is and what options are going to be offered and the fact that they're quality and affordable, but also talk about the gap before you leave it at how wonderful the marketplace is. I think it is important to keep reminding everybody that we're not including everybody yet. There is a group of very vulnerable people who are going to be left out on October 1st. And while hundreds of thousands of Missourians are going to have access to insurance that they can afford, that will cover what they need to cover, there are also a huge chunk of our neighbors who will be left where they currently are with nothing. And I think it's important to talk about that up front.
Well, I would also just encourage people to get on the website and to see. People are a little bit confused about the price of the insurance and the premium that they actually will have to pay. And in some instances, especially for people at very low levels of income, and as we know, people at 100% of FPL, the federal poverty level and above, can get a subsidy in the exchange. And I think we're going to be surprised at how much that premium is going to be. It's going to be very, very small. And I think even in some instances, in a bronze plan or catastrophic for young people, there may be no premium. And so we're going to be looking at a population, and the average income of a 25-year-old in Missouri, or in the country, is $17,500. That's going to put them right there at that threshold. And there may be solutions for them that we're not thinking of or anticipating that will be affordable, that will give them at least some coverage in case something really, really bad happens. And so don't think automatically that we're not expanding Medicaid and there won't be solutions for some folks, because there just may be.
Just to add to the whole gap concern too, I'm thinking it may be important to look at what providers will see and what clinics are available. Because I know now we have a network of clinics that see self-insured, but I'm sure all that is going to change.
Certainly managing the immediate health needs of anyone you're working with, because even if you enroll them for coverage on October 1, that coverage does not take effect until January. That's a long time if you're not well. And so managing the immediate health needs is certainly an important part of this, and there are some good resources that we are connecting to through Cover Missouri, and that you may already know of in your community for those immediate health needs. HRSA even has a zip code locator, so you put in your zip code and it pops up different clinic options near you.
I was just going to piggyback on that. You know, I think the gap is what keeps me up truly at night. I mean, it really is a pit in my stomach, and it breaks my heart. And I don't know how hopefully we can get something done. But I think the bottom line is I think it's important to try to walk folks through that regardless. Even if you think you may not have all the information, and that web portal is going to help them. So it's managing expectations and, say, look, we're going to go and see what you qualify for. Instead of, this is going to be the greatest thing since sliced bread, let's see what we can actually see what you're qualified for. And then I think it's being, as Lisa said, present for their pain if they're not able to qualify, and trying to give them a way to empower themselves, because I think that we really need to see what options folks have. And, the other thing is there will still be uninsured. We still see at the community mental health centers uninsured folks. So there are still options out there, but there's a whole lot of things in play with that. So I just strongly urge you to try to go through the process, because you may not have all the information, and the individual may not have all the information. I can't remember how many systems it connects with, but there's a ton of systems that it's going to be checking different things out. So just try to go through it, but manage expectations, I think, is the best way.
I have a question. When trying to assist these folks with, especially the different ranges and eligibilities that they may have, is there something we can do to prepare ourselves to look at, to see what those options are going to be before we start talking to these folks, to have it in our mind when we're speaking to them? You may range here, but let's go in and do this, or you may range here, but we'll see what's happening, as opposed to just taking one individual at a time and going online and following the process. Is there something we can do to educate ourselves about the eligibility beforehand?
Yes, there is. And that's a great question. There's a couple of things. One of the things that we do have online on the Cover Missouri, New Cover Missouri website, which launched this morning, so that's why we're so excited about it, is Kaiser Family Foundation and the Small Business Majority allowed us to embed their calculators on our website that allow you to go through and calculate if you qualify for a small business tax credit, and then also it allows you to calculate from an individual perspective. The site was designed to be responsive, so you can pull it up on your iPad or something like that. Also, some of the materials and tools that we've developed, we tried, and this is actually one of the things we tested in some of the focus groups to make it as understandable as possible. So there is a full one-page infographic and also a fact sheet specifically on the tax credits. And a couple of points on that is it is complicated because there's two kinds. And so one of the things that we did is we separated those out. So it shows what you need to do, and then it shows income. We go up to a family of 6 because that covers the vast majority of families, and then it tells how you can add it on if you have more than that. And it looks at it in income in a couple of ways, because if you're working at a couple of jobs on an hourly basis, you may know what you make a month, but you may not know what that is on an annual basis. So hopefully those tools will be helpful. All of our tools, and you'll hear this in one of the sessions that you're going to, we're going to be continually adding to it. And so if there's elements and things like that that you have, we certainly welcome your input.
I was also going to piggyback. I think the Cover Missouri website will be your best friend very quickly, but the training you will be receiving through the federal government will be extremely helpful. I've sat through several of their presentations, and I still actually get on every webinar because there's always something that you can learn, and I still learn things, and so, or a different way to present things because they've tested a lot of their information. So the training, I know you're overwhelmed and you're kind of like, how am I going to explain this to everyone? But you will be well trained to be able to communicate. But I think arming yourself with the Cover Missouri website as well as that federal training will be very helpful.
And for people receiving subsidies, advanced payment tax credits, I call them discounts, a lot easier for people to understand a discount. That is based on a percentage of income. So regardless of what the Missouri plans price their insurance plans, where that price is, we can have a pretty good idea of what families are going to pay because we know what their income and their maximum expenditure of that income can be. It's a percentage. So you can go to that calculator and find out. I will mention that a recent study in Kaiser brought up something that's very, very interesting, that about half the people that are going to get discounts on the exchange are buying their insurance already. Let me repeat that. Half the people that are going to get discounts on the exchange are already purchasing insurance. So if you're a sole proprietor and you're paying $8,500 a month for your family insurance, your the average estimated discount is going to be $5,500. They're going to have a $2,300 payment as opposed to an $8,500 payment. Big deal. A lot of people don't think of it, but remember those folks.
Yeah, and I hope you caught that, and that's something that's pretty important and not something I think we've been talking about already, are those that already are insured that might get some relief through the new system. So other questions for our panel?
So to Brian, who's a celebrity on my email, we're getting several of them a day, but we did an example yesterday where we had a family of 4 that was making about $44,000 a year, and they were still paying $203 a month in family insurance from our example. So several of us felt that was kind of pricey for a family of 4 making $44,000. Not that it wasn't reasonable in comparison to family insurance that you have to pay now. Most people won't even do it because it's just so expensive. But still, we're thinking there's going to be some families that are, because of other costs they have, maybe have a big mortgage and so forth, that they're just not going to do it. And they're going to pay the $200 fine or $100, whatever the fine is at the end of the year, because it's just more economically feasible for them. And we're going to have to, as CACs, we're going to be talking to people like that. And I mean, if they choose that, I mean, to me, that seems like it might be a good choice for them not to be involved with that.
Yeah, so the question is, what about a family making $44,000 a year? They've got a lot of expenses, and even the discounted insurance is expensive, maybe $250 a month, and they may choose to avoid insurance and go ahead and pay the fine. And the fine's going to be low. It's going to be $95 the first year. It scales up to what about $200 and $600 eventually at about 1% of income. And there may be some folks that do that. Remember that we're going to have different classifications of insurance. So we're going to have the metals, I don't think we're going to see any platinums, but we'll see gold, silver, and bronze. And then for folks under 30, they can buy a catastrophic plan. And so if that family is relatively healthy and their kids are doing okay, they've got a little bit of savings maybe, bronze plan may be better for them. So that could drop it down from 250 to 175, 150, whatever the level could be. We don't know exactly what that's going to be, but if it's a young family and they want to go ahead and roll the dice, if it's maybe young couples, they'll have under 30, they'll have catastrophic plans. So a little bit of a higher deductible. It's a very lower risk population, and so those are available for them. So the pricing that you're seeing on the calculator is based on a silver. It's not necessarily what they have to have, and there may be choices for them.
And Eddie, so embedded in that question though is what is the value of what you're purchasing? And so maybe
Yeah, I was actually going to answer that. I think one of the things that it's going to be unaffordable for some still, regardless, with the premium subsidies, advanced, whatever you want to call it. There is the advanced option, but I still think there will be some affordability issues, and I think the best way is to find, and I don't have the messaging down yet, but I think the best way is to describe what you're going to be buying a quality plan. So it's going to have the full soup to nuts of everything for the most part that you're going to need, whether it be prescription drugs, hospitalization, habilitation coverage that a lot of our health plans didn't even have that we have currently. So you're going to be buying a quality plan. And the other thing is I think that there will be some competition, hopefully, that will, drive down the price. That would be hopeful. But I think you also try to have a way to communicate how important it is to have coverage, because you're able to get preventative care versus having to go into the emergency room where, if you've been, I have a toddler, so I've been in the emergency room and I feel like it's, sometimes a waste of time because it's not quality. And so getting, the immunizations when they need to, and trying to figure out, I know those difficult situations where there's just literally no more money to eke out and there's not that conversation, but try to communicate that it's going to be quality, as well as that, it's better for all of us to be able to get it prevention on the front end versus having to be put into the hospital or having to go to an emergency room, which is just not the best quality of care.
Yeah, and to that, on the Federal Exchange website, there's going to be kind of an explanation a little bit of what insurance is, and it's going to talk about how much 2 procedures. We asked to have 3. They cut it down to 2, and I don't know if pregnancy will be one, but they give a couple of examples of how much something would cost if you had to pay for it in cash. And so pregnancy being $15,000 versus the payment of insurance, and a heart attack being something $60,000, $120,000 versus that payment of insurance. And so after people, and they focus group these things with consumers report, and after people looked at that, they realized the value of insurance, and so through that process, their knowledge base of what this is actually getting them was helpful.
Is there something that maybe coming down the pipe as far as advertising quality, like the quality of life, the quality of health, maintaining your health, changing your lifestyle, so that you can focus on getting something that can assist you now with what you have and maybe help you make yourself better, so that the cost of your care later on will go down and you can change your plan that you have at this point?
I should grab this.
Yeah.
So that's called the Public Health Prevention Trust Fund. And there are actually some questions about funding that will be involved in that. So certainly work on prevention is something near and dear to the foundation's heart. And Misty certainly comes from a background in working on that as well. But anytime we can put out those good quality public health and preventive messages, it's important.
Tied to the exchange so that people can see, maybe change their focus a little bit on how they're looking at this exchange?
I don't know if the marketplace will directly address preventive behaviors. It will certainly address the preventive care that will be available without copay that will support you in healthy behaviors.
You call that the public what?
The Public Health Prevention Trust Fund is the part of the law that dealt with that. And I'll turn this back to you guys.
I think maybe just to also add on to what Michelle is saying, this is also, to Lisa's point, where the stories can come in. So one of the things that we'd love to do is, in the beginning of the year, as we start seeing more people who are taking advantage of it, because we still have that enrollment through the end of March, is to help tell some of those stories of people who now have insurance, were able to go to the doctor and that sort of thing. I think what we heard in our research is at first we need to get people just informed about this before moving into some of the role of prevention and some of the broader health issues, because people right now are just looking at it as, I have no idea what this is. And that basic education is really critical.
And you point to, the Affordable Care Act was not the end of health policy discussion and health reform in the United States. And so that we need to have, and we are having, conversations about what it means to have a health home, to have a medical home, what it means to have access to those good preventive services, what types of long-term chronic conditions we need to learn how to manage better. Even in our public programs, how do we manage those better so that in fact the quality of care that you receive through the program goes up and the cost of the program goes down. So those conversations are ongoing. We encourage you to come at the foundation with those types of questions. We are not only focused on coverage. So the foundation has sort of a wide variety of health policy issues that we are here to support you on.